Hi, I'm Julia Yon. I'm the Vice President for Patient Care and Family Services and the Chief Nursing Officer at the Regional Medical Center. And we're here today to talk to you about patient experience.
Hi, I'm Monica Farr. I work in customer service here at the Regional Medical Center. And a lot of people don't know what HCAHPS actually stands for. And so I'd like to tell you now, it is the Hospital Consumer Assessment of Healthcare Providers and Systems. And that basically means that it is the survey that we use to try to figure out exactly how we're doing with the patient experience. And so it is the first national standardized survey that lets us measure the patient perception of their experience. This was first started in 2008, and here at the Regional Medical Center, we're a huge believer in this survey because it allows the patient to have a voice, which is one of the things that is most important to us. The other things that it allows us to do is to have some type of public reporting for how we do. And you can find this on hospitalcompare.com, which is the Department of Health and Human Services website that would allow you to be able to compare hospitals. Anyone under the age of 18 is not going to receive a survey, so there are some exceptions as to who's going to receive the survey. If a child is the identified patient, there's not going to be a survey that's sent out. So there are some exemptions. Right now, for patients who have had a hospital stay, we're sampling at 100%, with a few exemptions to that. But that's one of the things that we've tried, is to increase the number of surveys that we sent out in hopes of getting a better response.
Hi, I'm Pandora Ryan, and I'm the Nurse Director of MSSU, Telemetry, and PCU, and I oversee dialysis. And I think also that one of the reasons why I think people may not do a survey is just like any other survey that you get, they don't understand the importance of it. And for us, it's very, very important that people do fill out the survey, especially in our community, because this is a community-based hospital. And we need to know that our patients, we want to know what the patient's needs are and what we can do to make it better.
And so if we don't get these surveys, we don't get the reimbursement, we cannot provide the care that's needed for this community. And it's important. We want to have a strong community, so we need to have a strong hospital and have a healthy hospital. And another thing to remember on the survey is there are 4 options. The only one we get credit for is always. And that is important because it's not like in school where you get a partial grade. It's either all or nothing.
By identifying on their survey always, again, that is the only way that we get credit for accomplishing a question. So we are asking that for all of those patients who had a wonderful experience to not just throw that in the trash, not throw that survey in the trash and say, I already told them how wonderful it was.
What we want to capture is the average hospital stay, or the average patient's hospital stay as well. What we tend to see is that the folks who've had some type of negative experience fill out the surveys, or those who've had the over-the-top wonderful experience, but we're looking to hear from the average patient as well. That feedback is vitally important to us. We've talked about reimbursement, we've talked about giving the patients a voice, but generally we really want to hear from the patients who have come to the Regional Medical Center. They've chosen us for a reason, and we value their feedback.
Hi, I'm Julia Yon. I'm the Vice President for Patient Care Services and Chief Nursing Officer at the Regional Medical Center. Our mission is to provide high-quality, compassionate care to everyone we touch every day. If you or a family member have recently received services at the Regional Medical Center, we implore you to please return your survey. The receipt of these surveys is tied to federal funding and very important in our improvement of patient care. Thank you for being a partner with us.
Hello, my name is Henry Miller. I'm the Director of Environmental Services here at the Regional Medical Center. I've been employed now for about 30 years. Our job is to provide great customer service and give you the best health care service that you can possibly get in Orangeburg County.